welcome back to this 10-part series about metacognitive therapy. If you're new here, I'm Camilla, I'm a psychologist, and in each of these 10 short videos, we're covering a key concept or technique that's commonly used within MCT. This is video number 6 in the series, and we're continuing to build onto what we've already covered in the first 5 videos. So if you've not watched them already, I do recommend you going back and doing so to get a better foundation for understanding today's video. Today we're going to be looking at attention training technique, or ATT for short. ATT is a cornerstone technique in MCT, and it can really help us to transform the relationship that we have with our thoughts and emotions. So in the previous videos of this series, we've already covered some of the foundational concepts of MCT, like trigger thoughts, metacognitive beliefs, and cognitive attentional syndrome. Now, ATT builds onto all these other different concepts, focusing on enhancing our control of where we direct our attention. You see, ATT is not about distraction or avoidance. Instead, it's about training the mind to be more flexible and focused, which helps us to avoid overthinking, rumination, and worrying, which we often see in depression and anxiety. Now, the theoretical underpinning of ATT in MCT is based on the metacognitive model proposed by Adrian Wells. This model suggests that much of our psychological distress doesn't actually come from the content of our thoughts, but rather from our relationship with our thoughts, particularly how we control our attention. So ATT is very much considered a core component of MCT. It's based on the foundational idea that much of our psychological distress comes from how we control our attention, particularly how we deal with negative thoughts and emotions. So let's have a look at the primary goals of ATT. First and foremost, it's about enhancing our attentional control. This means improving our ability to control where we focus our attention and for how long. It's about developing the skill to be able to disengage from unproductive or distressing thoughts and instead focus on what's helpful or necessary. Another key goal of ATT is to reduce rumination and worrying. These are repetitive and often negative thought patterns that can dominate our mental landscape. By training our attention, we can break free from these cycles, leading to improved mental health and well-being. So essentially, ATT is about developing mental agility, the ability to direct and control our attention in a way that serves us better. ATT teaches us to distance ourselves from our thoughts and feelings, and instead move our attention flexibly to other more meaningful things. By practicing ATT, we demonstrate to ourselves that we can control our attention. This directly counteracts common metacognitive beliefs like, I can't control my attention, or worrying is controlling me, which are both examples of metacognitive beliefs like we covered in the 3rd video of the series. ATT also specifically targets cognitive attentional syndrome, or CAS for short, which hopefully you remember from the 4th video of the series. This syndrome is characterized by prolonged thinking styles like worry and rumination, threat monitoring, and unhelpful coping behaviors. ATT aims to disrupt CAS by training the mind to shift focus and attention more adaptively. Now, research strongly supports the effectiveness of ATT in reducing symptoms of anxiety, particularly worrying and rumination. It also appears that there's a positive, long-lasting impact of practicing ATT. Studies have shown that the benefits of practicing ATT, such as reducing anxiety and improving overall mental well-being, are not just short-lived, but can be sustained over time with continuous practice. So even though this technique was originally developed to be a component of treatment, studies are now suggesting that it can also have significant beneficial effects on anxiety and depression when practiced in its own right. Before we move on to looking at how we can actually practice ATT, let's have a look at one of the key reasons of why it works. So we can differentiate between 2 types of focus, internal focus and external focus. Now, when we have an internal focus, we're very much in our own heads. We pay attention to all our thoughts and feelings. External focus, on the other hand, is when we give our attention to external situations, events, or activities. So these are all the things that happen outside of our own mind and body. We can think about our focus on a scale like this, with internal focus on one end of the scale and external focus on the other. Now, when we're feeling depressed or anxious, we tend to see that we have mostly an internal focus, sometimes to the point of our thoughts and feelings becoming all-consuming for us. So what ATT helps us do is to shift our focus from that internal focus to a more external focus. It reminds you that you have the power to decide what you focus your attention on. Now, on most normal days, unless we are struggling with anxiety or depression, we typically see that our attention wanders all across the scale, right from being fully consumed in our own thoughts to being fully focused on something outside of ourselves. Again, it's important to remind remind ourselves that our attention is flexible and we have full control over it. For example, you control if you focus and dwell on negative thoughts and feelings, or if you focus your attention on an event or something that's happening in the present moment. This is what ATT can help us practice doing. Now, it's important to note that unlike what we often see in cognitive behavioral therapy, we're not trying to change or suppress thoughts. In fact, in ATT, we're not interacting with our thoughts at all. We're simply shifting our focus onto something else. It reminds us that our thoughts can be there without us choosing to give them attention. So the way we practically do this in ATT is we listen actively and we consciously focus our attention on different sounds around us. So when using this technique, we can divide it into 3 parts. The first part we call selective attention. This is where we focus on a single sound for a prolonged period of time. The second part we call rapid attention switching. Now you might have guessed that in this part we quickly switch our attention from one sound to the next. And the third and final part we call divided attention. Now in this part we try to pay attention to all the sounds around us all at the same time. The recommended time frame for practice in ATT is 12 minutes per session. And research shows that if you dedicate 24 minutes or 2 sessions a day, you'll start to see that your ability to control your attention improves quickly. So each 12-minute session can be divided up like this. Start off by doing 5 minutes of selective attention. So here you try to focus your attention on a single sound for at least 30 seconds, but preferably 1 minute at a time. When that time is up, you switch to another sound and focus your attention for about a minute on that as well. Keep doing this until the first 5 minutes of your exercise have passed. For the next 5 minutes of the exercise, you want to practice rapid attention switching. So here you want to only hold your attention on a single sound for about 10 to 20 seconds before switching to the next sound. Keep switching from one sound to the next until the 5 minutes have passed. And in the final 2 minutes of this exercise, you want to practice divided attention. So for these last 2 minutes, you want to try to listen to all the different sounds that you can hear all at the same time. Now, during the exercise, you'll probably experience having thoughts or feelings or urges come up. It's important that you don't try to stop or control these in any way. Just let these inner experiences be and refocus your attention onto the sound that you were listening to. If you like, you can use the scale from earlier to track your progress while using ATT. By marking down your experience focus before and after practice in ATT. If you feel your focus shifting towards being more external than internal, then you've probably done the technique correctly. Now I know I said that 12 minutes is the ideal time to set aside to practice ATT. But if that feels a bit daunting to you, try starting out with shorter sessions and gradually increase the duration. And don't be discouraged by common challenges like your mind wandering or feeling initial discomfort when doing this. With practice, your attentional control will improve. Now, practicing ATT in isolation by setting aside some time to go through these exercises is great, but you might also want to try out just incorporating ATT into your daily life. Try using different situations in your everyday life to practice your attention control. For example, at any point during your day, you can try switching your attention from an internal focus to an external focus. So if you do find yourself worrying or ruminating in a situation, try shifting your focus away from those thoughts, leave them be, and focus your attention onto something that's happening around you. That could be your work or a conversation that's happening around you. Basically anything external to you. Incorporating ATT into your life is all about small, consistent steps. It's not about perfection, it's about progress. In the video next week, we continue this series about metacognitive therapy by looking at how we can challenge and modify our metacognitive beliefs. I upload new psychological insights, tips and tools on this channel every week, and they're all aimed at spreading mental health awareness and helping you on the way to improving your mental well-being. If you're not already, I'd love for you to subscribe so we can meet again. Thank you for watching this one, take care, and bye for now.